Hello and welcome to a new session of another lecture. Today we'll be speaking about the program for non-communicable diseases in India. This is called NPCDCS, that is National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke. Cardiovascular diseases and stroke. So NP is National Peace Program for Prevention and Control of CDCS. C is cancer, D is diabetes. Again, C is cardiovascular diseases and stroke. This is of utmost importance nowadays because in the non-communicable diseases are increasing day by day. People are being affected by non-communicable diseases day by day because of their improper behavior and lifestyle changes. Because of their lifestyle, completely the lifestyle has changed from a moving one to sedentary one from in the past 2 decades. India has really transitioned from being an active country to the people who were active once upon a time have become sedentary. As you know, India is also called the diabetes capital of the world because it accounts for 40% of all the diabetics in the world. So all the diabetics, if there are 100 diabetics in the world, 40 diabetics are in India. So India is having the highest burden of diabetics in the world. That is why India is called the diabetes capital of the world. So all these things are lifestyle related. So the diabetes, cancer, cardiovascular disease and stroke, the common thing among all these 4 types of diseases or 4 types of conditions, lifestyle is the mainstay of even treatment also the same thing. Even treatment also for all these 4 conditions, lifestyle plays a major, or lifestyle change plays a major role. So let's delve in. Then hypertension, IHD and stroke. The cardiovascular diseases that were mentioned are hypertension, ischemic heart disease and stroke. So an overall prevalence of diabetes, hypertension, ischemic heart disease and stroke is 62.47, 159.46, 37% of the population and 1.454 respectively. That is, diabetes accounts to 62%. The overall prevalence, the old and new cases of diabetes account to 62.47%. And hypertension, all these are estimated are the lifestyle diseases or the cardiovascular diseases related to lifestyle. You can call it malfunction, like people who have not done, who have a bad lifestyle, they all tend to get these diseases. Estimated there are 25 lakh cancer cases in India at present. At the moment there are estimated 25 lakhs of cancer cases in India. So considering the rising burden of NCDs or non-communicable diseases, since they are rising compared to the communicable diseases, the government of India initiated an integrated national program for prevention and control of cancer, diabetes, cardiovascular diseases like IHD, hypertension and stroke. So all these and come under one umbrella called NPCDCS. So this is a brief introduction. Now the program is focused on health promotion and prevention. So as we know, lifestyles can be changed, or the adverse lifestyles, it's better to call adverse lifestyles, because lifestyle can be good lifestyle also. So an adverse lifestyle can be changed by promoting of health and prevention of disease, strengthening of infrastructure including human resources, early diagnosis and management, and integration with primary healthcare system through NCD cells, non-communicable disease cells, at different levels for optimal and operational synergies. So National Cancer Control Program, once upon a time it was a National Cancer Control Program. Now it is integrated. I mean, it is an ongoing program. It used to be an NCCP, or National Cancer Control Program. Now it is integrated in these, in the umbrella program, or in the program NPCDCS. So what are the objectives of NPCDCS, or objectives of this program? First is health promotion through behavioral change. How do we want to promote the health? Through behavioral change. Now again, behavioral change individually it is not possible, so we involve the community. So health promotion by behavioral change, involving the community, involving the media, involving the organizations, the community organizations, and different community organizations. All these things, you involve this, the community, to bring a change in behavior. How? By health promotion. This is the first objective. The second objective, screening at all levels in the healthcare delivery system, right from sub-center till the highest center. So screening of these diseases, screening of cancer, screening of diabetes, screening for cardiovascular diseases, screening for hypertension, all these things is to be done right from sub-center, the lowest level, till the highest center, to build capacity at various levels of healthcare for prevention, early diagnosis, treatment, rehabilitation, IEC, information, education and communication, or BCC, behavioral change communication, operational research and rehabilitation. Now exactly, it's a big sentence, but one very small sentence, one simple word. Remember, skill. The skill is imparted. Skill, the person is, or the person who is screening, or the person who is treating, he needs to be made aware of the skill. So the skill development, we call it as skill development, is done for prevention, for diagnosis or early diagnosis, for treatment, for rehabilitation, for IEC, for BCC. The skill has to be developed. So the fourth objective is to provide logistic support for diagnosis and cost-effective treatment at primary, secondary and tertiary levels of healthcare. So provision of drugs, provision of laboratory equipments for diagnosis, provision of drugs for treatment. So all these things are called provision of logistic support. To support for development of database of NCDs through surveillance system, and to monitor NCD morbidity and mortality and the risk factors. A proper surveillance system, detection of new cases, reporting of new cases, entering into the national NCD system, entering into the system, so that we come to know the burden of NCDs, so that effective prevention plans are developed, effective programs are developed to see how we can control NCDs. For that, the burden has to be assessed. For the burden to be assessed, a proper surveillance system has to be in place. So if you have a proper surveillance system, and that surveillance system, through the surveillance system, proper surveillance system, it is the new cases or the cases which are reporting to different places. It might be sub center, it might be primary health center, it might be community health center, it might be taluk hospital, it might be district hospital, it might be a medical college, the highest center. So we tend to take all the cases, feed into the surveillance system, so that the data throughout the country is collated, or the data throughout the country is collected, and then a proper burden of the disease is calculated. And once you know the burden of the disease, then the budget can be allocated and program can become successful. So that is the fifth objective of NPCDCS. Now the risk factors and level of NCD management. Risk factors here in NPCDCS, in this program, we focus on modifiable risk factors. As you know, non-modifiable risk factors cannot be changed. So non-modifiable risk factors like the genetics or the age or the gender, that cannot be changed. So we don't put our hands on that. We focus on things which can be modified. So what are the modifiable risk factors? Primary prevention, where health promotion is specifically done to prevent the use of tobacco, use of alcohol, and a healthy diet, promotion of a healthy diet, promotion of physical activity. These are the basic things. An unhealthy diet, lack of physical activity, then usage of tobacco, usage of alcohol. These are the things, these are the 4 factors which are responsible commonly for the non-communicable diseases. And hence, for that we focus on these 4 factors. Tobacco, alcohol, we tend to prevent it. Prevent the consumption of tobacco and consumption of alcohol. We promote physical activity and we promote a healthy diet. That is covered under primary prevention. The secondary prevention, it involves early diagnosis and treatment, or management, case management, early diagnosis and treatment. So how do we do that? BMI is calculated. The height, the weight of the person, the people who are screened is taken, and the BMI is calculated, or the body mass index is calculated, and through that we come to know whether he is either overweight or normal or underweight or obese. Underweight and normal, that is no problem. If he is overweight, we will try to stop him from becoming obese, and if he is obese, we will try to reduce the obesity, the magnitude of obesity. So we need to do an early diagnosis by measuring blood pressure, by measuring blood glucose, by measuring the cholesterol. So an early diagnosis, if it is done, then subsequently, if it is treated, then prevention is successful. We can stop the person from going to complications. So tertiary care, where if primary and secondary prevention have failed and people have started getting heart disease, stroke, diabetes, cancer, respiratory disease, all these things, they are treated appropriately according to their treatment, and seen to it that they don't go for complications, or if they have gone for complications, we see to it that because of the complications, their life is not hampered, or the life, they have a successful, productive life. Because of the disease, they should not be underproductive, or they should not be suffering. So we tend to release the suffering by treating the disease early and prevention of complications. And if complications have occurred, we tend to prevent the complications from worsening and making the life of the patient miserable. So that involves a secondary, tertiary prevention. Now, components of NPCDCS. First component is establishment of NCD clinics, non-communicable diseases clinics at primary health center and community health center (CHC) to provide integrated screening, diagnosis, and management of NCDs. Mind you, here there is just we do a screening in a sub-center, but we do not do an integrated screening. We do a simple screening. We do not do an integrated screening. We don't diagnose and we don't manage or we don't treat patients in a sub-center because there is an absence of a doctor in sub-center. So a primary health center is headed by a doctor, a community health center is headed by a specialist. So for that, integrated diagnosis or integrated screening can be done, a proper diagnosis can be done, and treatment can be initiated in primary health center and community health center. The second one, setting up of district NCD cells to coordinate NCD activities and strengthen surveillance and monitoring at the district level. So at the district level, at the tertiary level, setting up of NCD cell, district NCD cell at the district hospital, NCD cell is formed so that there is a proper surveillance is done. Proper surveillance and monitoring of non-communicable disease management is done. The third one is scaling up of cardiac care units and stroke care units at district hospitals to provide acute and rehabilitative care for cardiovascular diseases and strokes. Already there are cardiac care units and stroke care units already in place in the district hospitals. Those need to be strengthened. Those need to be strengthened by giving proper logistic support, by giving proper specialist care. All these things, they need to be strengthened. If there are no doctors, doctors need to be appointed there so that cardiac care units function optimally, the stroke care units function optimally. So we scale up. It is called scaling up, means we strengthen the already existing cardiac care units and stroke care units. Provision of chemotherapy and palliative care services at district hospitals and medical colleges for cancer patients. So for cancer, as you know, chemotherapy and radiotherapy are the cornerstones of the management. So for that, chemotherapy and radiotherapy, we formulate or we use chemotherapy and the radiotherapy in designated places, not in every place, designated places like district hospitals and medical colleges. Chemotherapy and radiotherapy cannot be initiated in a primary health center where a basic medical doctor is there. In community health center, even if there are specialists there, the facilities are not there, the radiotherapy facilities are not there. So these radiotherapy facilities can be found in district hospitals or medical colleges. Tertiary level, and strengthening of diagnostic services at various levels of healthcare system for early detection of NCDs. For early detection of NCDs, we strengthen the already existing the centers. They are equipped with the equipment which is required for screening of the disease early without any delay. Now, strategy for implementing national program for prevention, NPCDCS. The strategies are: NPCDCS program adopts a comprehensive multi-pronged strategy to effectively address the rising burden of NCD, because NCD is rising day by day. It is increasing, the burden is increasing because of the adverse health lifestyle of the population. So for that, a multi-pronged strategy, it includes strengthening the primary healthcare system. The already primary healthcare system is in place. It's a robust, it is good. Throughout India, primary healthcare system is really good. So for that, again, strengthening them with the faculty, with the logistics, with all those things, primary healthcare system is strengthened. Enhancing early detection and screening by provision of kits, by provision of personnel, the lab technicians, all those things. So early detection and screening is to be done, or that it should be strengthened. Then improving access to quality treatment, like by giving standard drugs, and by utilizing the services of specialists of that, like cancer specialists, or cardiovascular cardiologist, or an endocrinologist for diabetes. So we utilize the services of the specialists or super specialists, so that a proper treatment is given. And promoting healthy lifestyle choices among the population. The population needs to be educated regarding the healthy lifestyle, proper diet, proper physical exercise, avoidance of tobacco and alcohol. All these things need to be incorporated. So all these are different strategies. So if you combine all these different strategies, they are called multi-pronged strategy. Multi-pronged strategy. So the key elements, the as I said, health promotion, awareness, screening, and early detection. These are multi-pronged strategy. All these timely, affordable, accurate diagnosis, access to affordable treatment, all these form the strategy. Now the key elements. The key elements of NPCDCS, it includes establishing of NCD clinics, specifically dedicated to non-communicable diseases at primary and community health centers. Scaling up of diagnostic and treatment services at district hospitals. Treatment services and diagnostic services are strengthened. The district hospitals are equipped with the latest equipment and the good laboratory technicians, so that they screen, and good specialists, so that they treat these NPs and these non-communicable diseases appropriately. So, and also along with that, just about treatment and diagnosis and treatment is not only important. Along with that, equal importance is provision of health education campaigns to the population regarding the risk factors. The program also emphasizes the importance of multi-sectoral collaboration, or we call it as intersectoral coordination in primary healthcare. The same thing, multi-sectoral. We need to take the help of different sectors so that a healthy lifestyle is adopted. Convergence of various government initiatives and active community participation. Without community participation, a behavioral change cannot be achieved. Individually, behavioral change cannot be achieved. Individually, somebody will try to change their behavior, again get demotivated, come back to their normal state. Whereas if a community is involved, the different members of the community, they themselves form the internal motivation to the people who have started the changing their lifestyle. So screening and early detection. A core component of NPCDCS is the emphasis on early screening and detection of these 4 major non-communicable diseases like cancer, diabetes, cardiovascular diseases, and stroke. Stroke is a peripheral vascular disease. So cardiovascular diseases, peripheral vascular diseases, cancer, and diabetes. So these 4 need to be screened properly. Once the screening is done and diagnosis is done, then appropriate treatment has to be carried out. So this allows for timely intervention and management to prevent complications and improve health outcomes. So if once it is detected, treatment is initiated, and once if treatment is initiated, then complications need to be prevented. Complications need to be prevented, and outcomes or health outcomes need to be improved. So this, as I said earlier, that NCD clinics have been established. They are established at primary and community health centers where there are doctors, where early diagnosis can be done and a treatment can be initiated for these diseases. If it requires a specialized treatment, they are referred to the district hospital, where again there is another NCD clinic in district hospital. They can be referred to the district hospital. Then along with that, lifestyle modification forms the cornerstone of the strategy. So cornerstone of the strategy is lifestyle modification. Diagnosis and management. It emphasizes comprehensive diagnosis and management of NCD. So for that, NCD clinics are there. NCD clinics in district hospital, NCD clinics in CHC, community health center, and primary health center. For that, comprehensive management by proper diagnosis and treatment is done. So NCD clinics at primary and community health center conduct screenings, diagnostic tests, and provide evidence-based treatment plans. So at a CHC, they do not manage complications. They just give they do a diagnosis and they started treating at PHC as well as CHC. Whereas the complications, if they arise, they are treated at district hospitals. Because CHC, there might be a specialist, but there will not be any equipment. As I said earlier, there will not be any equipment. So specialized treatment like cardiac care, stroke care units, they are available at district hospitals or medical colleges. So that's why specialized cardiac care unit, stroke care unit, chemotherapy, palliative care, radiotherapy, all these things are available at only district hospitals and medical colleges, and not available in the secondary healthcare system, that is community health center and taluk hospital, or the primary health care system, where in like a primary health PHC. So that is next is capacity building. How do we proceed? How do we make the program successful? Capacity building. We update the doctors and the nurses as and when the technology is, as and when the knowledge is increasing, the different technologies they come. For that, then the doctors and nurses need to be updated. Why? Basic thing to increase or to improve the diagnosis, screening and treatment services. Second is a skill development program. Skill development program. There will be many nurses who will not be knowing how to do a proper canalization. For that, the skills have to be imparted for the nurses. There are specialist nurses. Those specialist nurses can impart skills to the other nurses who are not specialized in that. So this is skill development. The doctors also need to get updated every year or every periodically. They need to get updated in the treatment, because the treatment keeps on changing. The treatment which was there 20 years back, it doesn't hold good for the same treatment. It doesn't hold good nowadays. So the treatment keeps on changing because of the ongoing research. For that, skill development is done. The third, continuing education initiatives. So the doctors and nurses who are involved in the diagnosis and treatment, the doctors and nurses, they need to keep abreast of the knowledge, which is the new knowledge. For that, they need to do a continuous health continuing medical education programs. They need to attend the CME programs so that their knowledge is updated, so that a proper screening and management is done, and it benefits the patient. The fourth one, community health worker training. The people who are involved in screening in sub-center, they also need to get updated, because the screening modality keeps changing, or the tests which were done 20 years back for screening, they have changed now. HbA1c, which was not known completely 20 years back or 30 years back or 50 years back, it is now a known thing. We would emphasize on GTT, glucose tolerance test. Now we emphasize on HbA1c to know the real impact. So that's why the doctors which were there 20 years back, that they need to get updated. Or not only those doctors, the doctors who are involved in NCDs, they need to get updated day by day, so that the proper treatment, proper management, proper treatment can be done. Monitoring and evaluation. Key performance indicators. NPCDCS establishes a comprehensive set of KPIs, or key performance indicators, to track the program's progress, including coverage of screening, treatment, adherence, and reduction in disease burden. So a proper surveillance system leads to enlisting of all the cases, and it's put in the system. The burden of disease can be known, and that the people who are diseased, how they are screened, how they are treated, how many are going for complications, how many have a favorable health outcome, how many have got treated. So all these things are fed into the system, and through that we come to know which are the performance, the key performance indicators, which are the things which are improving the population's health. So that can be, population's health can be monitored by this way. The second way by which the person's health, the population health is monitored, is by a regular and a robust surveillance. A good surveillance system, it needs to be there for identifying where people are at high risk, identify trends, in what age or in what group it is more common. The trends can be identified. Then high risk people can be identified, and we can give evidence based treatment to those high risk groups. So surveillance is very much of paramount importance for prevention of NCDs. Evaluation frameworks. NPCDCS employs robust evaluation frameworks to assess the program's impact, identify best practices, and inform continuous improvements to enhance the quality and effectiveness of NCD services. So what all treatment is being done, that needs to be monitored, it should be evaluated, and any unfavorable outcome, that needs to be discussed, and again those measures which are suggested by the experts need to be incorporated, so that the program is strengthened. So the newer initiatives include population-based screening, PBS, for NCDs, namely diabetes, hypertension, and common cancers. So in the population, it has been expanded to more than 400 districts. So oral cancer, breast cancer, and cervical cancer, they are all screened in India. So it has been expanded to different districts. Screening is being provided through trained frontline workers like ASHA and ANMs. And suspected cases are referred to medical officers in PHC. So the screening is done by ASHA and ANM. A simple blood test or simple blood pressure, checking of blood pressure at 3 different intervals. If it is found high, then it is referred. It's not treated by ASHA or ANM. It is referred to a medical officer in a PHC, and any complications arise, that the medical officer is capable of seeing this. So initiation of NCD app for capturing patient-wise data and further follow-up from PBS district, that population-based screening district. Again, under Ayushman Bharat, NCDs are included in the spectrum of services being offered at health and wellness centers. NCDs are also now included. Then Pradhan Mantri National Dialysis Program, it is running in all the 35 states and union territories in 496 districts. India Hypertension Management Initiatives. This is being carried out in collaboration with the Indian Council of Medical Research, or ICMR. Then opportunistic screening of common NCDs include diabetes, hypertension, and cancer. This is like opportunistic screening, like people who attend the International Trade Fair in New Delhi in Pragati Maidan. The people who are attending there, they are screened. We get an opportunity to screen them. So opportunistic screening is done. Thank you for listening. Have a good day. If you have any doubts, you can put it in the comment. I'll try to answer as much as possible. If you have any suggestions or feedback, please do put in the comments. Thank you.